Another story, tons of you are searching on Facebook and Twitter. The measles. 5 babies at a suburban daycare center in Chicago have been diagnosed with it.
Yeah, not just in Chicago, the fears run deep, but we're talking to all children under the age of 1 or too young to typically be vaccinated. So that's something that's frightening all parents. Because according to the CDC, the first dose of the measles vaccine, known as the MMR, is usually given to children 12 through 15 months old. And then there's a second dose given to kids between 4 and 6 years old.
So if your child is not old enough to get vaccinated, what can parents do? Joining us now is Dr. Devi, assistant professor of anesthesiology and rehabilitation at NYU School of Medicine.
Yeah, and we actually wanted to hear from moms on this as well. So joining us from Chicago via Skype, Megan Dowdy and Eileen Ramito. Actually, Eileen's holding her beautiful little 12-week-old who starts daycare on Monday because Eileen's maternity leave has run out. So imagine you're struggling with that first and now you're dealing with this. So I want to start with Dr. Devi because the #1 question is, what do I do if I have a child under 1 and I can't get them vaccinated?
Right. So the way that you get measles is from other people, right? So even if your child can't be vaccinated, if the people around your child have been vaccinated, then the chance of that child getting measles is so low. So it's called herd immunity, but it's the idea that if measles has no place to kind of land, if everybody's vaccinated, then the few people who haven't gotten the vaccine will be protected too.
And so many parents have questions. And I have a 13-year-old son who's not in that age category or age group. Eileen, you have a 12-week-old starting daycare Monday. You probably have a ton of questions that you want to ask. What's your question for Dr. Devi?
Well, one of my questions is, I've heard about placental immunity for babies under about 6 months old. And I was just wondering if you could maybe expand on what exactly that is and what level of protection it provides, as well as like what kind of protection breastfeeding provides.
Great question.
Sure. So the idea behind placental immunity is that the mom has some immunity, from her immune system. So she's sending these antibodies which fight measles or fight other, pathogens, and basically sending them to the baby. Now, those will stay in the baby for up to 1 year, so the baby can be protected. If the mom's been vaccinated for measles, or if the mom's had measles in the past and now is protected against it, then, the baby has some protection. But it's a double-edged sword, because the reason that the baby can't get the measles vaccine is because if the baby gets the vaccine, the mom's antibodies, right, the mom's immune system that's there fights the vaccine as well. So, the baby can have some protection from that, but it's ideal. The best way to protect the baby is actually to make sure everybody else around the baby is vaccinated.
That's pretty clear. I didn't know that.
Yeah, and obviously a hot topic because there is an anti-vaccination debate that we won't get into just yet, because I want to ask Megan, who already has a 6-month-old in daycare. And Megan, obviously frightening for you, but what do you want to ask Dr. Devi?
Yeah, actually, she just started daycare this week, and so it's been a real hot topic around the daycare and our office. My question is, my husband and I are both vaccinated. Our 2.5-year-old is vaccinated. Is there anything else we can do? Should we ask for a booster at the baby's 6-month appointment next week? Is there any other precautions that we can take for ourselves?
I think you're doing all the right things. You can check with the daycare to see what their policy is about vaccination and stuff. But at the same time, boosters, you usually get them when you're a little bit older. You can get them when you're younger. It's usually at least a month after the first shot of the measles. But I think following the regular schedule of getting it between 4 to 6 years is the best. Now, sometimes if people have gotten 2 doses of the measles or the MMR vaccine, they're generally protected. But if you want to be safe, you can always go in and get what's called the titers, or your blood level of antibodies checked.
Yep.
So you can make sure that you're immune to measles. And if it's low, you can always get another booster.
I can't help this, but your baby is so cute, Eileen.
What is so too, but I'm a little biased.
It's 12 weeks old. What is your baby's name?
This is Delia.
Delia. Do you have another question for Dr. Devi before we head out?
Yeah, I was wondering about the transmission of measles. I've heard that it's airborne. What exactly does it mean? Like, how close does someone have to be to an infected person to actually catch it? Like, how long does it stay in the air, I suppose? Like, what exactly does that mean?
Sure. So measles is one of the most contagious diseases out there, right? It's not necessarily the most dangerous, but it is one of the most contagious. So it's in your bodily fluids, like let's say your mucus. So if you're sneezing, if you're coughing, if you're doing any of that stuff, it'll be there. Now, airborne, that means different things to different people, but it's the idea, let's say that if you sneeze out into the air, some of those droplets or some of that stuff, the virus is going to stay in the air even after the person goes away. So, let's say somebody sneezes on a keyboard, on a phone, or something else that the baby's playing with, for example, they can actually get infected that way. Even somebody who's gotten the measles vaccine, if they haven't gotten the 2 shots or if they haven't gotten full immunity, let's say they're, they have something going on with their immune system, like they have cancer or diabetes, they can still get it. So they don't actually have to be next to the person with measles. That's the part that's a little bit confusing. If the person with measles already spread the virus and then, left, then there's 2 hours basically that it can still be in the air.
Obviously a lot of information for all of you to process, and I know it's difficult. Eileen, good luck going back to work. I know it's a hard time. Megan, thanks for being with us and sharing your beautiful picture of your little one as well. Dr. Devi, thanks for the information. Take care, you all.